The Veterinary Feed Directive has just begun in the United States. What sort of questions is FDA still getting at this point about the new rules?
Yeah, and that's a great question, Joe. I think we've seen a big change in terms of how medicated feed is going to work in this country just recently. We've had some new drugs that have transitioned onto the Veterinary Feed Directive that will probably impact folks in the poultry industry and the pork industry, and as well as the beef industries. But those folks are starting to learn and starting to figure out how to utilize these VFDs, these Veterinary Feed Directive drugs. We've seen a lot of questions continue to come into the FDA, and our goal has really been to provide a lot of education here in the first bit of having these new drugs on the list, so that we can really get producers, as well as veterinarians, as well as feed mills to be able to comply with the new regulations as maybe they're seeing, some of them are seeing that for the first time.
So tell me how that's worked. Now, like I know in the pork industry, for example, where they have had some VFD medications available, how were those inspections handled? And what can other segments of the industry learn from them?
Last year we had started inspections even before the changeover of many of these new drugs. And we did that so that we could learn and get a baseline for data from these producers, these feed mills, as well as these veterinarians. The way we carried out that inspectional process is we had FDA trained inspectors go out and go to a feed mill. They would look through the VFD forms, order forms that were there, and they would see if it had been filled out correctly. If it hadn't been filled out correctly, they would help educate the feed mills on the proper way to do that and really get them a chance to be able to learn as we did that. I think there's concern out there that we were going to go out with a heavy hand, and that's not our intention at all. Our intention is very much to go out and educate these feed mills so that make sure that everybody knows what the rules are and how to abide by them.
Now, you mentioned the feed mill as an example. Is that always where an inspection would begin, or could it start on the farm or at the veterinary clinic?
Last year we started people at the feed mill, knowing that's where we would have the best chance to find the VFD order forms. From that point we could take and trace those back to the veterinarian and be able to follow it back and visit the veterinarian so that we could figure out if they were also understanding how to fill out the VFDs. We also took the opportunity to trace forward to the producer, doing a lot of the same things, making sure that they could also understand it. We put in our assignment last year that we wanted to educate. That was really our mandate there. And so we wanted to make sure we got a chance to visit the veterinarians and the producers. So we encouraged our inspectors to call ahead, make sure that they knew when to show up and when to meet. Because as you know, if you try to show up at a farm, a producer is never going to be in his office or his house. He's always going to be working. They're hardworking people, and we wanted to be able to meet them where they were.
And that was my next question was, are these surprise visits, or do you always give them a heads up?
The feed mills, we've been to feed mills for many, many years doing inspections for medicated feed mills. And so a lot of times we would come there just as we normally have in the past. Mm-hmm. The veterinarians, as well as the producers, is a new group of folks for us to look at, and we wanted to make sure that we got a chance to visit with them. So we did call ahead. We asked that our inspectors call ahead to make arrangements to be able to meet them and walk them through essentially the VFD form that they had.
And what specifically are you looking for? Obviously compliance, but kind of walk me through what you would be looking for when you, let's say, are calling on the producer or a veterinarian.
At each place, the feed mill, as well as the veterinarian and the producer, they need to have a completed VFD form and keep that for 2 years past when the feed was made and when the VFD was issued. So what we wanted to make sure is that it was fully complete and that people understood the different parts of it. Some of the things that are on that VFD form include items such as what feed was made, what the distributor's, the feed mill's address was, the name of the veterinarian, and those kinds of things, so that if there was ever an issue and we needed to follow that VFD feedback, we'd be able to do that through finding those paperwork records as we do any possible inspection or investigation that we would have to do for a for-cause problem. We didn't anticipate any for-cause problems in terms of that this year, and I think for the most part, we had the opportunity to go out and educate those folks.
And as far as the veterinarians are concerned, when they're filling out the form now, there's a separate form for just about every feed medication out there, and they have to check off the box for the indication. But as you probably know, some of the indications that are on the labels of these products that are 40, 50, 60 years old are not exactly in sync with the disease spectrums that might be out there. As I understand it from talking with Dr. Flynn and others, veterinarians have some leeway there in terms of making a clinical diagnosis and kind of drawing on their own intuition.
One of the things we really wanted to make sure is that the veterinarians were involved in this process. And so we've asked them to have a valid veterinary client-patient relationship, the VCPR, so that they have an understanding of the animals and an understanding of the facilities and the situations they might see at the farm. We trust those veterinarians to be the animal health professionals, and so we wanted to utilize their expertise in terms of disease diagnosis and what antibiotics might be utilized to treat these certain diseases. And so we really took that opportunity through this VFD to try to provide that oversight from the veterinarians and trust their clinical judgment in order to make some of these questions. We did look at the labels as all these things transition to all these drugs transition to VFDs, and made sure that they were in line with our guidances and what the current laws were, as well as updating the Bluebird labels. Now, the Bluebird labels are an opportunity for the feed mills to see the labels that are example labels that they can utilize in producing their feed tags. And we have all those Bluebird labels posted on our website for the FDA.
You mentioned the VFD forums before. Obviously, some veterinarians, producers, and even feed mills are going to be better record keepers than others. Are there any tips that you have for them? I mean, obviously, you can keep a piece of paper on file. Do you seem to get better compliance with that if they're doing it electronically?
I think we're too early to know whether we have better compliance by paper or electronic, but there are those options for those producers and feed mills and veterinarians to keep them some way. I know there have been questions that we've gotten in regards to whether a veterinarian and a producer and a feed mill might be within the same operation, especially in the vertically integrated facilities such as we see in the poultry industry. And so the key there is the accessibility. If those forms can be accessible when we come to do an inspection or when we have a need, that's really our goal that we're shooting for.
Now, this is obviously an ambitious program by FDA and really for the whole industry. How are you going to know that it's working?
During this first year of seeing this with the changeover just a month ago, a lot of what we'll judge whether it's working is whether, as we come upon people, they've been educated to what the VFD requirements are. Last year when we did our inspections, we saw times where people were not yet using VFDs, but they were getting ready to use them. And we think that this year we'll probably see more and more VFDs issued. Obviously, as a number of drugs have transitioned to VFD, we'll see that number of VFD orders increase this year. And I think our expectation is that as people become more educated in the process, we'll see even better compliance. I think there's a real general consensus amongst the drug manufacturers, the feed mills, the veterinarians, and the producers that they want to comply with this. And we've heard that as we've gone out and done webinars and done training with these folks. It's really a matter of them learning the information and learning how to do it that comes down to whether they can comply. And so we're trying to get as much information out as we can.
Okay, and that certainly explains how you will measure compliance, but the whole intent of the Veterinary Feed Directive, as I understand it, was to address various groups' concerns about the use of medically important antibiotics in food animals. How will we know that the Veterinary Feed Directive is meeting those goals?
It's a great question, and it's one of our overarching thoughts. We call it judicious use of antibiotics. And through this judicious use program, we're trying to make sure that those medically important antibiotics, those utilized in human medicine, can stay useful for both humans as well as animals. We want to make sure that any use that is being taken out is done under the supervision of a veterinarian. Those animal health care professionals that have that training in order to come through and utilize those antibiotics in the most judicious way so that we can make sure that we take care of those diseases, but yet still save antibiotics for the future use.
And how will the industries be graded? Let's take poultry and pork, for example. Is there some kind of a report card that FDA will have so that they can look back and say, this particular industry did really well in 2017 or 2018. We've seen lower usage of this particular type of antibiotic, or we're seeing lower incidence of a certain resistance. How will FDA measure that?
Yeah, although we don't have a specific report card that would indicate those sorts of things, we do have some measures that might help us. Some of those measures indicate that we'll see a change in the amount of antibiotic used. Now, I think with the changes to VFD, we also saw the removal of growth promotion claims on those antibiotics.
On the medically important ones.
On the medically important antibiotics, absolutely right. It seems to me that that has to change the amount of antibiotics used. Now, we're not sure to the magnitude what that might be. We do have the opportunity to look at sales data as well as in the future use data on antibiotics to see how those changes might be, but we don't have a specific goal set as far as what we want to see and when we want to see it. We just want to make sure that those antibiotics are used in a judicious manner so that they're there for future generations of animals as well as people.
Yeah, I spoken to FDA about this a couple of months ago, and they had indicated that they had partnered with, I think, a couple of universities and a few different states to perform whole genome sequencing on samples that would be provided by the National Antimicrobial Resistance Monitoring System. Is that still in the cards, or?
So whole genome sequencing is a tool that we may utilize in the future. I think it's such early stage right now. We're still trying to determine how that plays a part in what our monitoring processes can be. Obviously, with whole genome sequencing, we can see every nucleotide, we can see what its genetic fingerprint is, and we can see whether these certain microbes may have things like resistance markers or those types of things in them. It's a great tool to utilize, but we don't have specifically how we're going to utilize it quite yet.